Hi, Dr. Ashley Maltz. Appreciate you taking the time to talk with me about food and medicine and wellness and how we can educate people to make good food choices to promote wellness and health.
Thanks for having me. I am an integrative medicine physician practicing in Austin, Texas. I practice in a holistic and whole person way. So my training includes 4 years of medical school, allopathic medical school, a 4-year combined internal and preventive medicine residency, and then I went on to do extra training in integrative medicine as a fellowship.
This phrase, let food be thy medicine, what does that mean for you? What do you think? Do you feel like it's true? Is it possible, outside of course, surgical or traumatic injury? Can we actually use food as medicine?
Absolutely. And often food has been one of the biggest forms of medicine for thousands and thousands of years. It is also, if it's not used well, a major contributor of illness. It's estimated that 80% of diseases are preventable by lifestyle choices that we make, and food is probably one of the biggest parts of that lifestyle.
When I propose this question to you, is there a food prescription that you would be willing to make? You didn't even miss a beat. You just knew immediately. You were like, zucchini.
Yes, I love zucchini. Zucchini is easy. It's an easy, palatable, doesn't have a strong flavor so much. It can pick up the flavors of what you cook in, and it's easy on the digestive system when cooked. So there's not a whole lot of gas that's fermented or made when you eat it.
Are there any specific benefits that you can talk about when it comes to zucchini?
So it's anti-inflammatory. It's got fiber, which is always healthful and helpful. Carries lots of water. We need more water in our system, so that helps with bowel issues. And the skin of the zucchini typically has lots of phytonutrients, which are nutrients that come from plants. So we need them to have healthy systems. Lots of different vitamins like lutein, zeaxanthin for eye health, vitamin A, vitamin C, and vitamin B. So they're all important, and they all work synergistically to help the body.
So if I was to just pick up a zucchini from the grocery store, I'll obviously cut the stem off, and then do I peel it? How do you usually? What part of the zucchini do you eat?
So I eat all of it. I find that the most nutrients are in the whole plant, the skin and the seeds. So there's no plant part of it that's not edible. I sometimes will I'll cut off the ends and give them to my dogs because they like them.
Do you have a recommendation on a technique or anything like that?
I just slice mine either horizontally or, lengthwise, and saute them in olive oil, garlic, salt and pepper, maybe a little bit, and add it to whatever protein I'm eating that night. I often will mix other vegetables in there as well, but I really find that zucchini's versatile, it's easy, it doesn't, have a very strong pungent odor.
Can you think of a medication that might respond poorly, or even a physical condition that might not benefit from eating zucchini?
The only thing that comes to mind are for patients who are on low residue diets. So they may have really severe IBD, inflammatory bowel disease, like Crohn's or colitis, and they cannot physically handle the fiber coming through. So that's really the only contraindication I could imagine. That being said, in people who are, trying to heal their gut and their IBDs, then they would probably benefit from the nutrients in the zucchini. So it's kind of a mixed picture, but obviously, if you're having a flare or you're very prone or sensitive to fiber, then you don't want to eat it at that time.
Anything else you want to add?
So I always say eat more vegetables. So vegetables in general. We're so conditioned to eat white and brown foods in our society, and we really need to move towards the colors, the rainbow, all of the spectrums because they give us different nutrients when we eat them in combination. And yes, you can get some of that from supplements or a multivitamin, but it's not the same when it comes in its originally nature-made package and all the different symbiotic reactions that occur. So they work together harmoniously with your body to create, you know, optimization of your health.
What do you think is one of the things that helps people start to eat more vegetables? What do you tell your patients to get them to eat?
Well, if I knew,
Yeah.
I would use that all the time. Oftentimes, I'll tell people it's a lot cheaper than a heart attack. You know, the best way to live an abundant, full, vital life is to take care of your body. And so you can use it in your later years.
Thank you for your time. Thank you for teaching us about the importance of diet, the importance of eating vegetables, and for going out on a limb for zucchini.
Yay! It's a great vegetable. Thank you for having me.